Hi, Serena.
I'm here, Serena H. Chen, Dr. Serena H. Chen, from IRMS, Institute for Reproductive Medicine and Science at St. Barnabas in New Jersey. And I'm hanging here with my friend, another reproductive endocrinologist, Dr. Cain.
Hi, y'all. Now I say y'all because I just moved to North Carolina, and it's a really good word. It's a really good word. So I'm Kristen Cain, and I'm at Carolina's Fertility Institute, CFI, in Charlotte and Winston-Salem, North Carolina. And I'm also a reproductive endocrinologist.
Yeah, and we're really excited because we're slowly winning the battle to try to help people have more access to fertility preservation or egg freezing, which is something that is really everybody who has a serious medical problem that might impact your fertility should think about. And it was just fertility preservation for iatrogenic reasons was just passed in New Jersey. And maybe Dr. Cain can tell us what iatrogenic means.
So iatrogenic means that we doctors caused the problem. It means something that we did, not to hurt people, but when you treat people with cancer, you give them chemotherapy or radiation, it can affect the ovaries. Some people need chemotherapy or chemotherapy-like drugs for other things like autoimmune diseases, and people who are planning to undergo a transgender change, they will take medication that may have a permanent effect and may want to freeze eggs for that reason.
So the new law in New Jersey specifically covers people whose fertility is at risk because of medical reasons. Just like Dr. Cain said, like one of the most common examples is cancer patients and transgender, where we know that you have to take some sort of therapy that's going to have a really big negative impact upon your fertility. And before you go through that therapy, you have the chance to freeze your eggs, because when you freeze your eggs and they stay, they're like frozen in time, it helps to give you potentially a better chance to conceive after your treatment is done. It's not a guarantee, but if we can freeze some eggs before chemotherapy, then you might have a better chance of conceiving with your own eggs.
Right. It's almost like doing donor egg, but for yourself.
Yes.
So your egg
donating your younger self, right, donates to your older self.
Right. Yeah. Your future self.
Yeah, that's an interesting concept. But at the same time, New Jersey is only the 9th state to have this legislation, and probably only about half the patients in New Jersey will actually fall under this legislation. So there's still, even though the American Society for Clinical Oncology recommends that everybody that might want to have children in the future that has cancer should think about freezing their eggs, it's still a technology that is not accessible to most people in this country. And that's why we wanted to talk about it today, because we want to make you aware that this is something you should ask for if you're going through cancer treatment, or if a friend or a relative is going through that. It's a question that should be raised. And it's something that we hope that you guys will follow us on Instagram. I'm Dr. Serena H. Chen. Dr. Cain, you are?
I'm at DRKCAIN.
And we'll have those links. When at the bottom of our little blurb on the YouTube video. But we'd like you to follow us, because we do work really hard to advocate. We're going to continue working hard to try to increase access all across the country. Right now, it's only 9 states, but we're making progress. And we thank you for listening today, and I hope you follow us, because we're going to be making more videos.
Yes, we are. And thank you for coming to our little YouTube talk.
Thank you. Have a great day. Bye.
Bye.